first cause we're going to discuss is a herniated disc. Now, a herniated disc is most common in people under the age of 40. And how do you know if your symptoms is from a herniated disc? People whose back pain and sciatica is due to a herniated disc, they will have pain with bending forward. And I will discuss that later on, why that is so. But first, where is your intervertebral disc and what is its function? Now, in the image that you can see here, this is a side view of our vertebrae of our spine, and this is the front part of the spine, and this is the back. These are the knobs you can feel right down the center of your lower back. Okay, the intervertebral disc, as the name implies, intervertebral is the ligament that's in between each vertebra in our spine, from the neck all the way down to L5S1. The last disc in our spine is the L5S1 disc. Okay, so this is the L4, L5 one. The L4, L5 is the one that's most commonly involved with herniated discs and even degenerated discs. So there are two main parts to your intervertebral disc. And let me pull up this image right here and show you. So a normal disc, by the way, this is a top view of our vertebrae. So if we inverted this like so, as you can see, that's that view. Okay, so the two main parts of the disc is that outer layer, which is pretty strong, pretty fibrous. Okay, the center is a jelly-like structure. So your disc is pretty much almost like a donut with a jelly filling in the middle. That jelly-like structure is about 80 to 85% fluid in our late teens or mid-20s. Now that fluid content diminishes as we get older, and that's part of the reason why we lose height as we get older. Now, there are four types of a herniated disc. Let me reposition this back here. So the first type of a herniated disc is called a disc bulge. And you can see here in this image right here. So in a disc bulge, the jelly-like structure has started to migrate to the back, as you can see here, but it still is contained within that outer fibrous gray wall. Okay? Now, as you can see, in a disc bulge, you see how close. So if this is bulging, if this jelly-like structure, let me draw it up here. If the jelly-like structure from the middle starts migrating to the back, still is contained in the wall, but it's now bulging against that wall. It's now bulging against that wall. You could see how close it is to this nerve right here. See this nerve right here? Okay, that's your L4 nerve. So if that bulge, if that disc bulge, in a typical disc bulge, there would be some inflammation in the backside of the disc. It would, in most cases, produce back pain. And if the bulge is inflamed enough, irritated enough, it can also cause burning and tingling down the distribution of your sciatic nerve. Now, in the beginning of this webinar, we discussed that the sciatic nerve comes from 5 little nerves, and one of those nerves is L4, as you can see right here, coming from that nerve. So if we're having a disc bulge right here irritating that nerve, it could cause some burning. But typically, a disc bulge almost always produces mostly just lower back pain. The next type of a herniated disc is a disc protrusion, right here. In a disc protrusion, that jelly-like structure has migrated farther back against the wall, okay? So it's farther back here, pushing against the wall, but still is contained in the wall, okay? The third type is a disc extrusion, where that jelly-like structure has already actually broken the wall, as you can see here. And in most cases, if it has broken through the wall, it most likely will now be sitting against that nerve. So if this extruded disc is sitting against the nerve, what most likely would be the additional symptom that this patient would present? Most likely this patient would present with symptoms farther down their leg, and even numbness, and even weakness. Now, by the way, our nerves are like NIPSCO generating stations. They supply specific areas of Northwest Indiana with power, just like NIPSCO. In this case, your nerve supplies specific muscles in your legs with the juice it needs to perform its function. So in the case of, let's say, an L4 nerve that's impacted, the L4 supplies the juice that helps us control heel-toe action when we walk. If the L4 nerve is getting pinched from a herniated disc, this patients would come into my office presenting with what we call a foot drop or a foot slap when they walk. They could not control their foot from slapping the floor because of the L4 being impinged by this herniated disc. Okay? The fifth type is a sequestered disc, or the fourth type, I should say, of a herniated disc is a sequestered disc, where this jelly-like structure is broken through the wall, and a portion of that jelly-like structure, let me see if I can make this magnified. A portion of that jelly-like structure has actually detached itself from the remaining parts of that jelly-like part of the disc. In most cases, someone with a sequestered herniated disc will present mostly with intense leg pain. So, why is it, let's answer that question now, why is it that when you have a herniated disc, pain is increased with bending forward? So, going back to the analogy of that donut with a jelly filling in the middle, so if you put more pressure when you bend forward and you put more pressure in the front part of this donut or this disc, the tendency is it would push that disc farther back. And if you have an extruded disc or herniated disc, it would pinch that nerve and increase your symptoms more. Okay? On the other hand, patients with a herniated disc normally would find relief with bending backwards. Okay? Because again, you're putting the opposite pressure on the disc and pushing it a little bit more forward away from the nerve. Okay? So to recap, a herniated disc is most common in younger folks under the age of 40. Typically, these are the ones who are involved in heavy industry that involves repetitive lifting. Even truck drivers with prolonged sitting and vibration of their trucks makes them prone to a herniated disc. Nurses who do repetitive lifting and twisting and handling patients, and all other types of heavy labor jobs people are involved in. And again, a herniated disc would increase symptoms when you bend forward, and in most cases will relieve symptoms when you bend back. Now, some of you might be wondering and saying, hey Arlen, I have been diagnosed with my MRI showed a bulging disc, and yet I could bend forward and I'm over the age of 50. It doesn't really increase my pain when I bend forward, but my MRI says I have a bulging disc. Here's a little trivia question for you. Maybe you've seen this video that I've given out before, that I posted before. So here's a trivia question. What percentage of people in Northwest Indiana who are over the age of 50 would show up with a bulging disc on an MRI? I'll give you time to guess. The answer is up to 85% of people over the age of 50 will present with a bulging disc on an MRI, even though they're able to bend forward without pain. Okay? So the moral of the story there is you have to correlate your presentation, your physical presentation, your clinical presentation, your ability to move, what movements aggravate you, what movements make you feel better, versus the results of your MRI. Now, those people who present with a bulging disc who are over the age of 50 on their MRI, and yet they're able to bend forward, but they're also aggravated. On the other hand, they're aggravated by walking and standing, and they get relief from sitting. We will discuss that next cause in the next part of this webinar.